COVID-19 and Children Part 3 Q&A Vaccination. In this video, we are going to answer some important questions related to COVID-19 and children. Many young parents call and message me to know how to navigate certain parts of their and their children's daily life during COVID. Some might have found answers for few of their doubts, but might be finding it difficult to get answers to all. On Tejam, in this COVID series, we are compiling latest information from various sources to make it easier to such parents in finding answers to their queries and concerns in just one place. All these things are much more important right now to be known by all the parents because of the exponential rising cases of COVID. That is, we all are in midst of the COVID wave. First, let's start with question number 0, as it is on every parent's mind right now, who are thinking to travel with their children or who are already sending their kids to school but are worried that they might get infected with COVID-19 in schools. The question frequently asked in different forms is, I have 2 children with ages of 5 years and 13 years. Can I get them vaccinated with the vaccines available for adults right now? If not, when they will be available for children? The answer to first part of question is big no. The vaccines before being made available to public are tested extensively on the basis of age, region and race. Here are some reasons why COVID-19 vaccine is not yet recommended for kids. A. Separate testing required. The authorized vaccines are still in testing phase on children. Typically, vaccines are tested first in adults. Once they are found safe with adults, the vaccines will be tested on children. As adults and children's immune system behave differently, the vaccines meant for adults can't be given to children without testing on them separately. B. Adults affected more. COVID-19 appears to have disproportionately affected adults than children. Therefore, older people with higher risk health conditions are being vaccinated first. C. Children affected less. Kids, in comparison to adults, are at a much lower risk of getting severe form of COVID or requiring admission due to COVID-related complications. D. Spreading of the disease. Although children are great carriers of novel coronavirus, they do not spread the disease as much as adults. E. Vaccine production capacity. As life-saving medications need to be prioritized towards the most vulnerable, which is mostly adults in regards to COVID-19. And vaccine production facilities all over the world combined are still not able to produce enough doses to vaccinate all the adult population right now. Thus, as children are second in queue of priority, even after some vaccines are ready for use as testing phase is getting completed, all the vaccine produced will still be directed towards adults for the reasons mentioned above, and so they will likely be vaccinated in the final phase. F. Risk versus benefit. Vaccines for most of the diseases have some kind of adverse effects, and only the vaccines with very small number of severe adverse effects are approved for general public use. For example, before Pfizer-BioNTech COVID vaccine was approved for adults in UK, it was first ascertained that benefits easily outweighed the risk from the vaccine. By similar process, this is yet to be ascertained in children. Only after that, vaccines can be made available for mass vaccination in children. The answer to second part of question, when will the vaccines be available for children then? According to experts, vaccines for children might be ready for use by the end of this year or by early next year. The last part of question related to vaccine. Currently, for what ages have the COVID-19 vaccines been authorized for? While Covaxin, Oxford-AstraZeneca vaccine, Moderna, Johnson & Johnson and Sputnik vaccines are currently authorized for ages 18 and above. Pfizer has been authorized for ages 16 and above. But all the companies are already conducting clinical trials for younger kids. Hope this answers most of your queries and doubts regarding vaccination for children against COVID-19. And also, these are some of the other important questions regarding COVID-19 in children, which we will be dealing in the next videos. If any of the viewing parents have more questions or queries regarding COVID-19, or more specifically regarding COVID-19 in association with children, you can put down them in the comment section. We will answer them in the next videos. If you like this video and don't want to miss on such informative content, like, share and subscribe and hit the bell icon below so that you are always updated on Indian and global COVID scenario and crisis.